Hi, it's Dr. Charles Bradley here from Domino Veterinary Hospital. It's Friday, so it's Facebook Live time. Welcome into our world here. We're going to talk about puppies. Puppy 101. Of course, the spring of the year, new life, new hope. Unfortunately, right now, as I look out my window, we have a lot of white stuff coming, so it's the wrong month for that, but it's a great month for new puppies. And boy, there's so much to talk about with puppies. So I'll try and hit the high points as if we were talking in the exam room here on some of the things that you should be thinking about. So how about when you're choosing a puppy? Are you going to go to a breeder? Are you going to get just a puppy from another family? Are you going to maybe not get a puppy and get a mature dog? So I think most veterinarians would tell you as a general rule, you'd be safer from a health standpoint avoiding a purebred. It doesn't mean that you should not get a purebred. But the hybrid vigor of many different bloodlines coming in is always helpful. And so there might be some considerations on which breed that you would want. And there are certain breeds that are known for certain issues. Example, say for bulldogs and other brachycephalic dogs, we have to be very careful about them. They're very cute, but they have a foreshortened skull, so that can lead to some issues. There are certain breeds that are known for certain familial problems such as eye problems or hip dysplasia. There's a lot of research that's available on that. And so you would be talking about that with your veterinarian, you'd be talking about that with the breeder. And that leads into another idea, and that would be to visit the puppies or visit the breeder ahead of time, get a feeling for what kind of a health care record that they have, what kind of husbandry, what kind of sanitation is there. Whether the breeder has noticed any of these familial issues. That is the inherited pieces of it. So you might ask the breeder, has there been any heart problems? Has there been any hip problems? Once you do your due diligence and your research. And it's a really good way to see how puppies behave because they're all together in their little group of litter mates. And behavior is probably the biggest single thing. I think choosing a patient based on how they behave is a good strategy. And that brings me to another thing which is called socialization. We talk about that a lot these days. How does a dog fit into the world? And here at Domino we do see a lot of anxious dogs, and I think part of the reason is that many of our dogs are transported from the south now. We don't seem to have enough dogs in New England for native adoption, so we bring dogs in from the exterior. And it can be very stressful for a dog to be transported. It can be very stressful for a dog to come to the veterinary hospital. So puppy socialization is actually a topic that I want you to be aware of. There is a fairly predictable fear period in puppies. I've noticed that up until 8, 10, 12, maybe 14 weeks, they can absorb a lot of information. So their brain's like a sponge, and they're really absorbing all the different components of their lives, all the different inputs are coming in and they're processing, and they're very open to learning. So good behavior is based on learning good outcomes. So dogs and people are kind of the same that way. They like good outcomes, they like good feelings, good thoughts, and they don't like negative stuff. And they're very plastic, their brain is really working, so they have a time when that kind of shuts down. So we want puppies to be socialized, and that means having them together, having them learning, and having them be in safe situations, being exposed to different stimuli. So that can shut down at a certain period. And so we have puppy classes, and we've talked about that before here on Facebook Live. And then it seems like there's another potential fear period that occurs when they're kind of in their teenage years. So I would say from 12 to 24 months, it seems that a lot of dogs get anxious. So that's something I want you to think about when you're thinking about what breed to get, thinking about how you're going to work with the puppy, think about the amount of time that you're going to spend when they're really, really young, exposing them to all kinds of different situations, and have them being open to a variety of different stimuli. So how about puppy nutrition? Puppy nutrition is, oh man, that's a huge area. What I like to do is talk about legacy brands. There's 4 brands that I prefer that are very well proven, and I like to know that a puppy is going to grow at the best possible, most scientific rate, if you will. So I don't want too much growth and I don't want too little growth. I want it optimal, because a puppy can only grow when they're little. So that 4-week, 8-week, 12-week, 16-week period is very important. By the way, if you have any questions, send them over. Kelsey's here with me and I can answer them if they come in. So puppy nutrition, I usually talk about IAMS, I talk about Purina Pro Plan, Royal Canin, and Science Diet. So I like those because I know that there's a lot of research. They have full staffs. They actually house puppies and do feeding trials, so they're very well proven. I think boutique brands are good, and if you are choosing the right one, that's fine, but I don't know what the right one is. And so I'm just going by based on my 35 years of experience and getting good outcomes. So obviously people feel very strongly about different foods and you will have your own opinion, but I want you to think about puppy nutrition. Now, what about vaccines? So what is a vaccine? So I'm going to hold up a little icon here. I don't think it's going to come out right. It might come out backwards, and that's supposed to say DA2PP. What is that? Well, that last P is parvovirus, and that first D is distemper. The A is adenovirus, and the P is parainfluenza. So these, the D and the P, let's talk about. So distemper is a whole body dog virus. It can be very devastating if a dog gets that. We don't see very much of that here in New England, and it could take a dog down quite quickly. But what we do see is the parvovirus, which is a bloody diarrhea of puppies, and that can be very devastating. It's almost like Ebola. It wipes out their system, and unless they're on IV in intensive care, they usually don't make it. So I would say parvovirus, man, you've got to really be up on those vaccines, and risk can start right away. I mean, we will start vaccinating puppies as early as 6 weeks. So the rule of thumb is we see puppies every 2 to 4 weeks, depending on the schedule. We'll start seeing them at either 6, 7, or 8 weeks, and then every 3 to 4 weeks we'll see them for their vaccines. And they need at least 2 to 3 vaccines in their initial puppy period. And we like to give them their last vaccination at 16 weeks or later for the distemper parvo. Now there's another couple vaccines that will come up from time to time. And this one says lepto, L-E-P-T-O, lepto. Leptospirosis is a bacterial infection. It can go through the oral route. So if a puppy is drinking from a puddle and say a skunk that had leptospirosis urinated in that puddle, the puppy could get lepto. So keep that in mind. And this one here is another L, Lyme, L-Y-M-E. We might be doing that in the later puppy period. And then when puppies get to be about like 16 weeks and maybe as early as 12, rabies. Rabies is the only thing that you legally have to do to your dog other than provide good care in Massachusetts. So rabies, basically the rabies and the distemper, that's core vaccination land. And then the Lyme and the lepto that we talked about before, I consider these optional vaccines depending on risk factor. So we'll talk about this. We'll talk about where your puppy is going to be. Lyme and lepto usually enter the conversation because of the risk factor. And then there's another one that I didn't write up called Bordetella, kennel cough. So that's kind of an upper respiratory infection. It can have 2 viral causes, which we vaccinate against, and Bordetella, which is the bacterial cause. So you want to make sure your puppy is protected against Bordetella, especially if there's play groups, and we've encouraged that earlier in this video. So I would like you to consider the vaccines, and let's just drill down a little deeper on that first vet visit. So the purpose of the veterinary visit is to look at the puppy, make sure that's a healthy puppy, make sure that's a good fit for the family. And sometimes if you're with a breeder, they will insist on an initial exam. Some of the common things that I see in puppies, very, very frequently, I'll see a dental problem. So I might see teeth coming in too narrow instead of like this. They come in too narrow and the lower teeth will jab up into the gums or even into the hard palate, and that's very painful for puppies. So when you're assessing a puppy, you want to make sure all the teeth are coming together. They're all interdigitating properly. That's one of the things I look for. I listen for a heart murmur. I want to make sure that the heart is good. I'll look for fleas. I'll look for an abdominal hernia. I'll look at the eyes, and I'll look for ear mites. So some basic things that we've just discussed, but there's a panoply of other possibilities. You basically want to get a clean bill of health. And you want to get a sense of how that puppy is going to work in your home and what kind of risk factors are present, because there's so many different wellness things that we can do. And we should probably talk about some of the things that we talked about. This is a Sentinel, it says. This is a free puppy kit that the company provides. Sentinel is a heartworm preventative. So even puppies can be exposed to heartworm disease. And this also provides, many people don't know this also provides protection against intestinal worms. So even though you might say that, oh, I need the heartworm pills, which is Sentinel, you don't realize that you're actually controlling hookworms, roundworms, whipworms, and you're actually preventing fleas. So I think that keeping in mind intestinal parasites with puppies is a huge thing. And we do serial dewormings. We also check for intestinal parasites by analyzing the stool. And we have run into situations where a puppy has had roundworms, and that's a big thing if there's little children in the home, because the roundworm that's in the stool of the puppy's poop can get into the child. It's a fecal oral route. So there's that connection. I just want you to remember that there can be a connection between intestinal parasites of dogs and people. So you can see there's an awful lot to discuss. There's also fleas and ticks. I'll just have a word on that. We've talked a lot about that recently. This is an oral flea and tick for the 4 to 10 pound range. This is something that you give by mouth. And I tend to start puppies a little later because this is an oral. And I'm very conservative on what I put into the puppy. So you'll be talking to your veterinarian about how you're going to fit all of this in. So if you have a 5 pound puppy, the veterinarian will be much more selective than, say, a 25 pound puppy. And puppies come in all different sizes. So that's sort of like a nutshell. There's so much to talk about with puppies. And I invite you to contact us if you have a question about puppies. Kelsey, did we get any questions today?
No questions.
No questions today? Okay, so I encourage you to think this process through. The thing about getting a dog is they are active mind individuals. They're very smart. They need a lot of interaction. They need 1 to 2 hours of vigorous exercise every day. They need mental challenges. So I think we've passed by the time when a dog stays in the backyard or tied to a pole, and I know many of us are well past that. And we have dogs that do spend 2-3 hours. We have one dog that walks 6, 7, 8 miles every day, and that's just awesome because that's what a dog wants to do. So there's lots to discuss. Thank you so much for looking at Facebook Live. I'm Dr. Charles Bradley, and until next time, stay healthy with your puppies, and we'll talk to you next time.